Hello and welcome to our course on the 10 Principles of Patient-Centered Design. My name is Andrea Hall with the Institute for Patient-Centered Design, and I'll be facilitating this course with our instructor, Tammy Thompson. The Institute is a nonprofit organization that was established to develop and inspire creative design solutions that promote healing and wellness. We operate primarily through the service of volunteers who are practicing professionals in the fields of healthcare and design, as well as patients and parent volunteers. Before we get started, there are a few housekeeping items that I'd like to cover. This program is registered for One Health Safety and Welfare Continuing Education Learning Unit by the American Institute of Architects. Architects may submit their AIA numbers in the course exam. Unless otherwise noted, the following content is the property of the Institute for Patient-Centered Design Incorporated. Please request permission before duplicating or distributing this material. Patient-centered design is a philosophy by which health facility stakeholders make provisions for patient empowerment, comfort, safety, and satisfaction. This principle takes into account the needs of patients and their families, and employs methods for delivering the best care to them. While many product and facility designers aspire to create patient-friendly environments, this goal can be lost in the design process. This course will present the 10 principles that may be established on a patient-centered design project and review examples of design strategies used to address each principle. By the end of this course, participants will be able to describe the history of patient-centered design, identify common obstacles for patients and families that are inadvertently created in the design process, describe the needs of patients and families as they relate to healthcare design, and finally, analyze methods for addressing the needs of patients through the use of the 10 principles of patient-centered design. Patient-centered designers believe that while we can build facilities that meet code requirements, a lack of compassion for the users of these spaces can create a number of problems. Before this was realized, hospitals were called institutional places that sometimes created health concerns instead of alleviating them. Not so long ago, there were strict standards that literally created a nightmare of an experience for patients. Hospitalization, which could be considered the most vulnerable time of a person's life, involved housing patients together in a facility where they were treated and hopefully released. This included grouping strangers together in the same rooms, restricting their interaction with family and friends, as well as transporting them from one area to the next through public passageways, where onlookers could see them scantily clothed, sedated, or in pain. This environment was often the breeding ground to infection, depression, accidents, and staff errors, which led to subsequent health concerns or worse. It is no wonder that many people developed hospital phobia. Patients were traumatized by these experiences, and visitors were fearful of ever requiring a hospital stay. You might be familiar with the report released in 1999 by the Institute of Medicine entitled "To Err is Human." This report shed light on alarming statistics involving patient safety in hospitals. It states that at least 44,000 people, and perhaps as many as 98,000 people, die in hospitals each year as a result of medical errors that could have been prevented. In addition, costs resulting from medical error was estimated between $17 billion and $29 billion per year in hospitals nationwide. This report was a wake-up call that the healthcare system needed to take action. Not only was the patient environment feared, but research revealed that it was just as scary as it looked and felt to patients. Finally, there was tangible evidence to motivate action. The Institute of Medicine reports that almost immediately the Clinton administration issued an executive order instructing government agencies that conduct or oversee healthcare programs to implement proven techniques for reducing medical errors and create a task force to find new strategies for reducing errors. Congress soon launched a series of hearings on patient safety, and in December of 2000, it appropriated $50 million to the Agency for Healthcare Research and Quality to support a variety of efforts targeted at reducing medical errors. This new movement for improving healthcare delivery inspired valuable research that has informed and promoted a more humane environment. Though the philosophy of family-centered care was in use a decade earlier, and the concept of patient-centered care existed over 2 decades earlier, this new information finally motivated hospitals to take a careful look at patient-centered care. Let's take a look at what patient-centered care means to a few of the pioneers of the practice. According to Plaintree, in a patient-centered approach to healthcare, providers partner with patients and their family members to identify and satisfy the full range of patient needs and preferences. The 8 picker principles of patient-centered care are: 1. Respect for patient values, preferences, and expressed needs. 2. Coordination and integration of care. 3. Information, communication, and education. 4. Physical comfort. 5. Emotional support and alleviation of fear and anxiety. 6. Involvement of family and friends. 7. Transition and continuity. And finally, 8. Access to care. Here is the Institute for Patient and Family-Centered Care's definition of patient and family-centered care. Patient and family-centered care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. It redefines the relationships in healthcare. So, how are designers able to utilize this information to improve the healthcare environment from a built standpoint? Through patient-centered design. Our goal in patient-centered design is to step inside the shoes of the patient and to wear these shoes throughout the entire design process. The Institute for Patient-Centered Design has identified 10 principles that align the patient-centered care goals to use in the design process. Let's take a closer look at these principles to see how an environment can be created to engage and protect patients. Patient-centered design supports the practice of patient-centered care by creating environmental conditions that facilitate healing. The following principles may be applied to health facility design to engage patients. Number 1, respect privacy. Number 2, facilitate communication, collaboration, and trust. Number 3, encourage patient and family participation. Number 4, empower patients. Number 5, promote safety and security. Number 6, provide accessible accommodations. Number 7, create a comfortable environment. Number 8, facilitate healing. Number 9, support staff's goals through design. And finally, number 10, look for design opportunities to respond to unmet needs. Now let's explore these 10 principles and see them in action.